On this, let's welcome in Texas Congressman, Chairman of the House Appropriations Committee, Jody Arrington. Mr. Chairman, good morning to you. Look, why are Republicans not pushing this message harder that these COVID-era subsidies are overdue? COVID's gone. It's done. If the extension doesn't expire, we'll go back to Obamacare like it was prior to COVID. I mean, what's wrong with that?
There's nothing wrong with it, except that even going back to Obamacare pre-COVID had premiums and deductibles doubling since the inception of Obamacare because they sold a bill of goods or lies that you could keep your doctor and would have affordable health care.
Right.
That hasn't been the case. And now we're just layering this fraud-ridden COVID subsidy on top of a failed program. And we're propping it up and pretending that somehow Obamacare has solved the affordability. It's actually exacerbated the unaffordability in health care. So this should be a very straightforward vote for Republicans. And we ought to, as you said, expose Democrats for the fact that CBO says 6+ million people are on the program who are ineligible. 40% of them don't even know they're on the program, yet the insurance companies are benefiting. And lastly, the GAO did a study, nonpartisan GAO, that tens of thousands of Social Security numbers from dead people are being used to draw down subsidies that would enrich insurance companies. So it's layer after layer of bad policy and failed policies, and the American people are paying the price.
So they don't just vote, they also get health care under Democrats.
Yes, all of the things, apparently. So we know that Republicans, as you just mentioned, have unified around a single health care plan that would eliminate enhanced tax credits. Senators Bill Cassidy, Mike Crapo say that the plan could lower 2027 premiums by 11%, deliver funds directly then to patients. Can you explain more about the GOP's proposal here?
Well, the Senate has one or set of reforms, and their reforms would, like you said, take the monies instead of giving them to the insurance companies and brokers and everybody involved in the transaction to families and individuals and empower them as consumers. What we also have to do is deal with the anti-competitive forces in the healthcare market, and a lot of those are stemming from the regulations and mandates in the, quote, Affordable Care Act and in the broader healthcare market. And so some of the things in the Cassidy plan would address that, like cost sharing reduction. All that is, it's a loophole that allows insurance companies to basically direct people to more expensive plans that they may not want or need. And that's obviously artificially increasing premiums. So Republicans are trying to clean up the mess of years of government intervention. The answer isn't another government program. The answer is less government, more competition, more innovation, and more patients and families of patients acting like consumers where they get to choose what they need, what they want, what they can afford. And that's not happening. It's happening in almost every market in our economy except for healthcare. And the culprit, as Ronald Reagan says, government isn't the solution, government's the problem. And we have to be honest with the American people, and we've got to be aggressive at implementing a plan. And if we can't do it with Democrats, we need to use reconciliation like we did with the big, beautiful bill and finish the prosperity agenda, tax, regulation, all the things we put in there, work incentives, cutting spending. We need to include health care reforms that actually work in bringing down the cost of care.
Mr. Chairman, Jody Arrington, great to have you with us this morning. Thank you so much.
A lot of work ahead of you.
Always good to be with y'all. Thank y'all.
All right, well, let's keep this conversation going and welcome